Now, here are just 5 basic questions that every Indian is probably asking right now, and I'm going to try and answer them to the best of the information that we have so far. Remember, the one thing that COVID has taught us is that everything is evolving. Number one, does the China COVID surge threaten us here in India? It's possible infections could surge. Remember, already 2 cases of the BF7 variant that's crushing China have already been identified here in India. Number 2, what is the Indian government doing at this point of time? They're identifying new variants, asking for protocols to return at this point of time. Question number 3, could India see another COVID wave potentially? There is a possibility of this, because an increase in cases is almost definitely to be expected. Whether it becomes a wave is yet to be seen. Do you need to take another booster dose of your vaccine? Not yet, as far as the government is concerned. No specific instruction as far as an additional booster shot is concerned. And finally, question number 5, could restrictions or even a lockdown return to daily life? Mandatory mask, mandatory social distancing and things like that, only if severity of infections increase. I repeat, at this point of time, there is no reason to believe it will happen, but it's best to stay prepared, because we're dealing with a crisis in a country where we can't even depend on authentic information. Let's go straight to Dr. Randeep Guleria for our first question. Dr. Guleria, is a surge in India expected as well, given what we're seeing happening in China right now? There are already 2 cases of BF7 that have been identified here in India. Do you think there will be a surge in India as well, like it is in China, sir?
So like you rightly said, this sub-lineage of Omicron has already been seen in India in October, which is being reported from China. The situation in China and India is quite different. In China, because of the zero COVID policy, there is a large number of people in China who are sort of naive or are not being exposed to the virus. Also, the vaccine uptake in the elderly and high-risk group is low, and we don't know about the efficacy of the vaccine. The situation in India is different. We've had a good vaccine uptake, even a booster dose has been given, and we have data that the vaccine is effective against the new variants. Also, a lot of people have got natural infections, so there is also immunity because of natural infection. And because of the fact that our population is protected from all of this, the chances of the new variant causing a severe illness and more hospitalization or deaths in our country seems to be less likely. But having said that, we need to be more vigilant, because we know as cases increase in a particular area, the chances of mutation and new mutants coming up also becomes more. Therefore, good surveillance for any cluster of cases, any increased hospitalization in our country needs to be done, and very aggressive genome sequencing so that we pick up the variant early and are able to link it with any clinical or epidemiological change which we see in the pattern. Currently, India is in a good position, but I don't think we just need to rest. We need to be prepared for any situation which may arise.
Dr. Guleria, the Government of India held a high-level meeting today. Various things were discussed. What should the government do right now in terms of the kind of advice that goes out to people? What should be the next few steps in the next few days or weeks to come?
So I think, as has been already said by the government, there needs to be more of testing. We need to encourage people to come forward and get themselves tested. Many individuals who have classical COVID symptoms don't get themselves tested. So they should get themselves tested, because then only will we know if they're positive, and we can do genome sequencing if we have a proper sample. You can't do genome sequencing if you do the rapid antigen test. You need to do an RT-PCR test to be able to do genome sequencing. So people should come forward and get the RT-PCR test done. Also, we have to have surveillance, which is sentinel surveillance, surveillance in hospitals. So if there is increase in hospital admissions or ICU admissions with flu-like symptoms or viral pneumonia, then that should be a red flag, so that people know that there is something happening, and genome sequencing of all these samples should be done. So sentinel surveillance may also be very useful. And I would say physicians and healthcare workers should be alert that if a cluster of cases happens in any part, then that should be immediately reported. Large-scale testing should be done there, so that we're able to identify any new variant in that area, and we're able to link that with the clinical and epidemiological profile of what is happening there, and then take measures to control the spread.
You know, Dr. Guleria, most people, I would hazard to say, even as recently as yesterday, you know, were wondering whether they were ever going to see headlines or news about COVID ever again. And now there's blanket coverage, you know, led by Sneha's team of this COVID crisis here in India. And many people are wondering, the outbreak that's happened in China reminds us of something we never wanted to think of again. But many are now asking if there will be a replication here, sir.
Correct. So there are two parts of this. One is when the outbreak happened in China in December of 1919 and then went on to 2020 and then spread to Italy and subsequently to other parts of the world, we as a population had never been exposed to the coronavirus COVID-19, and therefore our immune system was not at all prepared or tuned to fight this infection. We have come a long way since from there. We are now in a better situation because of vaccination, because of previous immunity, due to the getting infection, and therefore our body is able to fight the infection better. But the virus also is clever. The virus develops immune escape mechanism and it's becoming more good at that, but it's causing more infection but not severe infection. So we will see cases which will not go away. COVID is going to be here to stay and we will continue to see infection, but that is quite all right if it's just a flu-like syndrome, rather than having severe pneumonia like we saw last year when the Delta variant was there. Currently, the Omicron lineage is a milder form, and the sublineages don't seem to be causing severe pneumonia, especially in those who have been vaccinated and protected because of previous infection. So unlike China, because of vaccination and previous infection, we are now having a good degree of immunity, both as a population or what we could call as herd immunity, and therefore the chances of us getting severe infection is less. Yes, we will have cases of COVID. There will be some who will require hospitalization and have severe illness, but that will be much lower than what we were seeing last year.